Cool. So it's great to hear. I don't know why it's red Allah everywhere. What do you see? Do you see anything on the screen?
I am seeing myself on the screen.
Okay.
What are you seeing on the screen?
I was seeing the reds, and I think I see you now, which will be good. So let me see if I can try and get that. Oh, from reds to everyone, no screen. Okay, so let me try and do it this way. So it's always tricky. And let me go, if I can go on full screen here. Nothing. You can chop this bit off. Can you? One. Can you see something?
I'm seeing you sharing the screen.
But nothing on the screen yet.
Oh, no, there is. You are sharing on screen.
Okay, good. So if that's there, I think that will be good to start. So thank you very much. I think we are just a couple of minutes over the time to start. So I know there is some technical hitch, but let's get started. So today is an important topic, addressing anxiety and depression with Qigong. And many of you might not know what this Qigong is, and I'll kind of explain this a little bit. And then we have got a very special speaker today who is very, very deep into Qigong. It's a Chinese origin system of medicine, which is like Indian system of medicine, Chinese system of medicine, which has been surviving for several thousand years. Tai Chi and Qigong and acupuncture are there, and they're still there. So we have chosen particularly topic of the anxiety and depression because there is a big mental health burden within the UK, but across the countries, which are developed countries, and the developing countries are catching. So let me just share with you the burden of the disease and what it is. So if you think of that, there are 264 million patients of depression, and people are affected worldwide. And this is the data from the World Health Organization. If you add anxiety is on its own 284 million. And this is not transient anxiety for 1 or 2 minutes. This is anxiety which is lasting for like weeks, months. And that is considered the chronic anxiety. And this is on the anxiety scale. They are called global sufferer of anxiety disorder. So a transient anxiety going for exam or going for interview does not count here. This is anxiety disorder qualified and identified. The economic burden, this is because we don't have specific data for the UK. The data from the United States is $1 trillion spent, and that's the economic burden. And that actually, if you expand, there is a lot of other countries. So that is the extent of the global economy resulting from the anxiety and depression. And that's actually quite significant amount. And this is something which we can help. As we say that there is no science which is going to work on its own. So modern medicine is fantastic, and I'm a modern medicine practitioner, and I have been practicing the Western medicine for 30 odd years, but I know that there are certain conditions where there is no cure, and therefore it's good to use alternative and complementary medicine just to help bridging the gap or filling the gaps. So just to tell a little bit about what is Qigong. Now it's Qigong, and I know some people call it Qigong, and that's absolutely fine. It doesn't matter. The correct pronunciation is Qigong, and I believe Fexia will connect if that's still not right. And this combines gentle movements with the controlled breathing and a focused intention. And many of this actually connects to yoga, where we have controlled breathing, but that is done usually as alongside the meditation or deep focus inwards, and there is no movement. It is sitting still. So it's just a variation of it, but works in a very similar way. But the focus is on chi or vital energy, which is inside our body. And as I mentioned, that there are like 2,000 years or more, and there are around 60 million people who are practicing or engaged in this Qigong. And that's actually a significant number. And this is particularly important for the Western countries or developed countries. Now, there are three different types mainly. So one is medical Qigong, second is martial Qigong, and third is spiritual Qigong. And without even going deep into it, I think medical Qigong is the main focus for today because there are a lot of conditions. We are not going to talk about all. We are trying to focus on the anxiety and depression today, but there are many respiratory disorders, abdominal disorders, and many, many other disorders where it can be used. Now, the other variation of this is the strength and speed and power, and that's actually very useful in fibromyalgia, in chronic fatigue syndrome, etc. And then you have spiritual Qigong, which is very similar to the meditation. And it integrates the meditation to the deeper awareness. And I'll probably just go through why does it work. So if you go back to the anxiety, it has physical symptoms, rapid heartbeat, shallow breathing, and muscle tension, which is what happens to all of us if we are in a tense situation, like going for exam or interview. But then if it lasts for a long time, there is firing of the neurochemicals and internal neurons, which go into the fight and flight response as we were in many million years ago. And there is serotonin dysregulation, and that affects the mood regulation. And that is the scientific basis of this. And the reason we are talking today in this way is because there is a need for people to understand the scientific basis so they can believe what works and how it works. And once you understand how it works, you can believe it works, and you will probably have some practical exercises that you can do. And I would be grateful. I think Fexia is going to actually run through some exercises. Now, the other part which I would want to focus is that the racing that happens when this fight and flight response lead to catastrophic thinking, and the attention is focused on the potential threats rather than solutions or problems. And there's a feedback loop that keep going. And this produces the symptoms, low mood, and etc. And when it goes on to the spectrum of the depression, and if depression happens, then there's disrupted sleep, appetite change, fatigue, etc. And this is again due to the imbalance of the serotonin and dopamine and BDNF, which is brain-derived neurotropic factors. And this is now, if you can understand the science behind it, and if you think there are structural changes found in the functional MRI, reduced hippocampal and the prefrontal activity, which is the main executive functioning area of the brain. And that is where the changes are happening, and it can be affected by genetic factor and stress, etc. So the important thing to consider why we have brought this the Fexia today is because there is significant benefit of Qigong in mental health. We're going to talk a little bit about the meditation and the medication. So we are not going to stop a specific safety advice. Do not stop any medication that has been prescribed your health practitioner, and always go to a qualified health practitioner. This can be done alongside, and as your clinical situation improve, you can try and reduce the medication. The reason we want to add this as a complementary is because there are side effects of the long-term use of the antidepressant and anxiolytic medication. There is delay in the onset, and also there is individual response. Some people have partial response or no response at all. This is non-invasive, no side effects, and work alongside the conventional treatment or conventional medication or pharmaceutical industry can be happy with that it's working along. And there is mind-body integration, which is the seat of the problem. And therefore, this is going to be very useful working alongside. The other important is that patient is empowered with self-management tools. So the patient or yourself, if you are a sufferer, you have the benefit of controlling what you want done. So patient choice is done, and there is self-efficacy. So now briefly about the biophysical effect and the respiratory system, the oxygen intake, metabolic efficiency, then cardiovascular system, improved circulation and autonomic regulation, and in nervous system, balance, sympathetic and parasympathetic activity, similar to what happens in the neo yoga, and there is associated immune functions, which is improved cellular immunity and inflammation. Now I'm going to bring you to even nitty-gritty, the cellular level, which is biochemical level of ATP, which is the energy powerhouse in the mitochondria. So those who you have done science wouldn't remember ATP or an ADP, the adenosine triphosphate, which serve as the universal energy currency in the cells, and it powers the cellular process through the energy releasing reactions. And if you think Qi, we talked about is energy. So Qigong enhance the oxygen delivery and the mitochondrial function, and this result in more efficient ATP production. And that's how it is, the traditional perspective of Qi. And then I think she's going to talk a little bit more, so I'm going to bring her in, but just wanted to mention the integrated understanding of this whole biochemical pathway and how both can work together is extremely important. And this is how the clinical pathway I have designed, combining Qigong with the medication, initial assessment with the comprehensive anxiolytic and depression and medication initiation, and then you introduce Qigong into it twice weekly regime, something like 2 or 3 sessions, and then go for a full combined approach. And if you've got time, we'll talk about it. So that's how it is. Combining these will work. I think I'm going to stop here and we'll try and bring Fexia in. Question mark, how do I stop? Here it is. Cool. So can I introduce Fexia? She is a senior lecturer in the University of Lancashire, but also does a lot of sessions on Qigong. She has done with the Open University, I think 8 or 12 weeks recently. She has done with University of Manchester. She runs groups. I think she has gone today again for a women group. And the whole idea is she understands what is there. She has a deep understanding of how it works, but she practices it on a day-to-day basis. So I think she's going to talk a little about this, how a little bit parallelism with the understanding and mechanics of the energy that we talked about. And then she's going to do some exercises which we should be able to do with her in order to have the first-hand benefit. Over to you, Fexia.
Okay, great. Thank you very much, Professor Gupta, for your introduction. I think I will just share screen. Okay.
If you press the green button on the bottom, yeah, perfect, that's working.
At the moment, okay, so
you can go on full view if you want.
I want to give it the full view, but it's not on. Oh, yeah, it is on full view now.
Yeah, it's on full view now. Cool.
Okay, I'll shift this thing away.
Yeah, seeing it absolutely fine.
Okay, yeah. So today, I think that the topic I've been given by Professor Gupta is addressing anxiety and depression with Qigong. And I think it's a very timely topic, both in China and in the UK and the rest of the world. It's a problem that we are all facing. And in China as well, it's the younger age children are also having to face with anxieties and depression. There are many causes, and with like over use of the electronic devices, etc., not enough physical exercise. We are not going to look at the cause of that, what the societies cause, but we're mainly looking at, in terms of the body, what is happening to the body that is causing the anxieties and the depression. But we look at the perspective of Qigong. And okay, so first, what is Qi? And I need to move this in here. Okay. So a Qi is, we can look at, if you look at the the top right corner of the screen, there are two writings. They both are pronounced as qi. They both mean the qi, but actually they refer to different types of qi. The first one, if you look at the character, there are 4 dots at the bottom. It means they signifies fire. So that would mean, in a way, we understand qi is something that's warm, that's rising, and the top, it means nothingness. So the whole Tao is thinking about there is nothing out there. There's something that comes from nothing. This whole concept of nothingness. So that's the philosophical grounding of the qi, because it's untangible. You can't touch it. You can feel it. You can feel it in your body, but you can't touch it. You can't see it. Unlike in Western medicine, through anatomy, you can find the different organs. You can break it down to different tissues of the body, etc. But with qi, you can't. Once a body dies, you just can't feel it. So that's one concept of the qi. The other concept of the qi, if you look at the character, the top corner, it looks like the wind. In Chinese, we say 云者气也. So the qi is like the cloud that flows around. The wind blows the cloud, the qi flows, etc. But that's only one part of qi, meaning the air. But there is also the other part. It's signified by the character underneath. It looks like a grain of rice. That character is called rice. So the qi is almost like the food that you eat, the nutrient that you get into the body. It can be turned into qi, so can be used by the body to sustain its life. So that is basically what the qi is. Qi, you can also see it as in yoga, we talked about pranayama. So the prana is, I would think, it's another word for qi. And in Chinese, we call it qi. Okay, so the vital energy. So how does it relate to life and health? We mentioned that qi exists in all living beings. Where there is no qi, there is no life, and vice versa. You need for qi to exist in a living organism. And then it's not just air and breath, but it's the life living force. It means energy in traditional Chinese medicine. And there are different types of qi. There is the yuan qi that you were born with. There is the zhen qi, the real qi. Wei qi, that's also the qi that's guarding the body, and etc. So that you can further break it down to different types of qi. But for health, you need to have a sufficient amount of qi in the body. But only having the sufficient amount is not enough. We also want to have very smooth, unhindered flow of the qi in the body. So that the key word is the unhindered flow. We don't want any blockage. We don't want any stagnation. We also want this energy flow, this qi flow, in a very balanced and harmonious way. So that is the key. So what is Qigong then? The Qigong is the ancient Chinese mind and body practice that integrates movements, breathing, and meditation, and may help with depression and anxiety in several ways, both physiologically and psychologically. So that hence what we are talking about, using the Qigong as a supplementary tool of intervention to combat anxiety and depression. Like Professor Gupta mentioned earlier on, it's important that you don't stop medication. And we never tell the practitioners to vary their medication. Medication can only be altered, reduced, increased, whatever, or stopped by their physician. We are not medical staff. We only help them to practice, to help the energy flow in the body. Hopefully, it eases the symptom, but we can't suggest them to stop the medication. Okay. And then talking about qi, there is also the yin yang, the whole concept. You see the middle of the screen, there is the black and white fish. And this, the yin yang, refers to the different movement of qi. And for example, when you have the qi that is descending or contraction of the qi, then it is yin, while the yang is the expansion and ascending of the qi. So we usually say 动能生阳. Particularly for patients with depression, we ask them to move, to do some movements, because the movements can help the body for the qi to rise in the body. So that is important. Another concept of the qi is the xu and the shi. So xu meaning insufficient amount of qi. But then that leads to the question, well, can you have too much qi? If you can have insufficient amount, then that will go naturally. You could also have too much qi. Is it possible to have too much qi? And particularly when you see practitioners, trying to get rid of this. Anyway, you can see the picture here. What we want is for the qi to flow like in the water pipe, watering the garden. That's the proper qi flow. We don't want any kink in the pipe. Okay, and that would cause the stagnation and blockage of qi. So we want qi to flow well in the body. And coming back to the question about can we have too much qi? If you have people that have got all the time in the world, they sit there, they do their meditation, or they do their pose stand, or they practice other dynamic Qigong, can they have too much qi? Some will say yes, but some will say no, you can't have too much. Any excessive amount will naturally flow out through the center of your soul. There is a place called Spring Bubbly Point in the middle of your so the fleshy part of your the ball of the feet, and it will just naturally go. What actually happens for some people to display symptoms of as if they had too much qi is the blockage or stagnation of qi. We can have too much qi in one particular part of the body, but not the whole body. So you could have too much qi in your head, which can cause headache. And or too much qi in other parts of body, there is the stagnation there. Okay, so depression is very often the cause of can be caused by qi deficiency. So the solution is to replenish qi with exercise, good sleep, and nutrient-packed food. And in a minute, we can do some movements to lift qi up, pull qi down, la qi, etc., to generate qi. And the next one. Yeah, so we talked about can you have too much or not enough? Usually, most of the time is we have insufficient amount of qi, particularly when we are tired, we were exhausted, we didn't sleep well, or as we age as well. As we age, we have consumed a lot of qi, so we need to then do exercise to try to replenish it. Okay. Here, just to basically mention that a lot of people get confused with Qigong or Tai Chi or other Kung Fu. Most people in the West will know the word Kung Fu because of all the martial art films, etc. They also know about Tai Chi because of in year 2020, the Chinese Tai Chi enters the UNESCO's Intangible Cultural Heritage list. But even before that, a lot of the martial art is also involving with Tai Chi. Tai Chi, by the way, has martial applications. It can be used for that. But most people practice Tai Chi now for health enhancement purpose rather than for fighting purpose. And there is another word, it's called the Dao Yin. So Dao Yin has got as a word has got the longest history. It focuses on health preservation through physical movements, i.e. the gentle stretches. But we also ask people, practitioners, to have to give attention to the breathing and mindfulness. Just now, we talked about, you see, you remember one of the slides have got a hose pipe that got a kink to it. And that means there will be blockage in the water pipe, but also in our body, there will be blockage for the qi. So the Dao Yin as an exercise is these gentle stretches will stretch out the energy channel, the meridians, to help the qi to flow better. Okay. And Qigong, the word we say, just think about pranayama. Prana is the Qigong yama. So you practice the qi. It's focusing on very slowing down, lengthening each inhalation and exhalation, and mainly into the lower abdomen. It can be practiced in a dynamic way, i.e. with movements, or static way. You can have sitting meditation, you can have standing meditation. We sometimes call it pose stand. You can also have the supine meditation. You're lying on the side of the body, and with the hand and the feet put in particular situation that will help the energy flow, and you want to direct it to flow in a particular way. While Qigong can be described as a special kind of Tai Chi, it has martial art applications, but although now almost exclusively for health enhancement. There is also a saying by some researchers, they will say Tai Chi has got a much longer history than some people would give the credit for 200 or 300 years, and saying it originates in the Chenjiagou village. And that's the sort of like the birthplace of Tai Chi. But they say, well, that's not true. Strictly speaking, Tai Chi as a form of exercise actually originated much earlier on, is closely linked with Taoist practice. That's because through meditation, particularly with the standing meditation, after a while, you will be able to sense the energy flow, the qi flow in the body. And then if the qi flows, it guides your hand move in a particular situation, your body just go with the energy flow. Then it morphs into some sort of sequence. And then later, people then adapt it for martial art purpose. So Tai Chi itself, when it was practiced by Taoist monks in the very beginning, it wasn't as physical exercise. It's almost like organically, it just evolves from the very simple physical movements that was caused by the energy flow. Okay, so both, but anyway, coming to the people's confusion between Tai Chi, Qigong, and Dao Yin, both Tai Chi and Dao Yin are typically use very slow flowing movements. The key is the yin-yang balance, which is rooted in the traditional way. So here I'll give you some examples of classical Dao Yin routine. So you have Yi Jing Jing. Yi Jing Jing is coming from the Shaolin Temple. Talking about that, there is the Indian Mo Zhu Shi. So one of the Indian Buddhist masters came to Shaolin Temple, and then he imparted some Indian martial art practice to the monks in Shaolin Temple, and then also with the meditation, etc., etc. So I think for researchers interested to find out the link between, was there any genuine link between the movements of in Shaolin Temple in martial art there with the Shaolin, with the martial art in Kerala? Some people would say yes, there is a clear link there. Okay, we're not going to that discussion, but here I just want to explain why in Shaolin Temple they practice that. It's because monks are required to sit meditation for a long time. When you're sitting cross-legged for a long time, energy flow does get stagnated. So then the Dharma then taught the monks to do exercise to increase their spinal flexibility to help the energy flow. And this little tiger movement is one of the classic movements there, like a hungry tiger pouncing at its prey. Okay, you can see the strength there. And then there is the Wu Qin Xi. It's created by a famous physician nearly 2,000 years ago, 1,800 years. And Dr. Hua Tuo. This routine imitates animal movements. And then we also have Ma Wang Dui Dao Yin Shu. On this illustration, you see It was unearthed in the 1970s. It's got a history of nearly 2,000 years. It's the earliest, one of the two earliest written evidence of the Chinese people using exercise, the physical exercise for health purpose. And you can see 44 figures here bending the body in different ways. And some of the figures also have some annotation next to the figure telling you what they are doing. They are stretching their upper back, lower back, or they are flying like birds, and or they were imitating a wild duck swimming, etc., etc. You can see there's quite a lot of bending on the hip, on the waist, and then stretching out, etc. This is to help energy flow. And also in here, because we are talking about Chinese medicine, we're talking about Chinese philosophy, you see there are some figures holding a stick. And with this stick, this person wearing black in red trousers, the words, the writing says 上通阴阳. The stick can connect yin yang together. So yin is the ground energy, yang is sort of like a more heavenly, the sky energy, etc. So with the stick, you can connect the yin yang together. So that's sort of like evidence of this type of concept, the yin yang concept, was already embedded in people's everyday life. Okay, and then we've got some further exercise. This is 八段锦. So 八段锦's got a history of over 800 years, 8 movements. You can see the old illustration is almost like monks practicing. And this is the most widely practiced routine across the world. And particularly, it was very, very widely practiced during the COVID period, because you can't go anywhere. You have to do exercise. So the best exercise is to do the Qigong, because it doesn't require any special equipment, doesn't need a lot of space. And that in a way makes it a lot easier for people to practice. This one is also good because, the first one, 双手托天理三交, both hands holding up the sky in order to regulate the energy in the upper, middle, or lower burners, i.e. the triple burners. So that stretching up the body, depending on which system you want to look at it, it actually lengthens the spine, creating more space in between the vertebrae, and also creating more space in the chest and abdomen cavities for the internal organs to move about. So it helps with the circulation. And then the second one, posing as an archer, and then it helps with the lungs, opening the chest. The third one, holding up the sky with one hand, is designed to regulate regulate the digestive function of the spleen and the stomach. One hand pushes up, one hand presses down. That helps the energy flow along the spleen and the stomach meridians. And this one, the fourth one, was particularly relevant for our discussion of depressions or anxieties. And this one is just the person stretching out the arms and turning it. So to turn both hands and then looking to one side, i.e. looking back, looking inwards. And then you're supposed to cure the excessive exhaustion through work, but mainly any emotional overworking of the mind. It helps you to quiet the mind. Okay. And then swinging the head and the tail to bring the excessive heat from the heart meridian coming down, and then bending forward bend, holding onto your feet to strengthen the kidneys and the lower back, and punching to strengthen the power, the force, okay, of the limbs. And then the last one is interesting because 背后7点百病消 is you stand up on your tiptoes. So standing on the toes and then come halfway down and totally stamping down. So let the heels fall on the ground, and that creates a vibration. That, you know, we talk about the energy flow. When there is a stagnation in the energy channel, then there is pain, there is problem. But by stamping, sort of creating a vibration, you may be able to dislodge any stagnation, so the energy will flow better. And that's why you're saying even 100 disease can be cured by just stamping the heels on the floor, etc. So I think rather than going on more about what can be done, I think we could do some exercise.
Wonderful. That'll be great.
Yeah.
Okay.
So if you find yourself, I don't know where everybody is. Okay. So yeah, if you can find yourself a space with your stand naturally upright, with your crown up and chin gently tucked in. And when we say naturally upright, we mean crown up and chin gently tucked in. And what we'll do is we do a few little meditations, lifting chi up and pouring chi down. So soften the knees. On your mirror, so sink your weight into your right leg and slowly take your left foot off the floor and take a left step, heels down, toes down, ball of foot, and then the heels. Now in here, we use your imagination, visualization. Imagine you are staying in a swimming pool surrounded by nice warm water that comes up to chest high. Breathe in, gently round your shoulders back, sink the fingertips down, and slowly raise both hands. Feel the resistance of the water on the palms and the fingers, and bring palms back towards you. Breathe out and press down. Feel the water bubbling up between your fingers. Again, breathe in and lift. Feel the resistance of the water on the palms and the fingers. Bring palms back. Breathe out and press down. Feel the water bubbling up between your fingers. That's the sensation of the qi flow to the extremities. Again, breathe in and lift. Feel the resistance of the water on the palms and the fingers. Breathe out and press down. Feel the water bubbling up between your fingers. Now let the hands hang by the side. Take a deep breath in. Reach your fingertips down and slowly raise both hands. Middle fingers stretching far away as you slowly collect the qi. Hold above your head. On top of your head, there is an acupoint called the Bai Hui acupoint. Open the Bai Hui point and press down with your hands, guiding the qi into your head, neck, chest, abdomen, thighs, lower legs, and all the way down to the middle of your feet. Again, breathe in and lift. Feel the heaviness on the palms and the fingers. Hold the qi above, open Bai Hui, guiding the qi into your head as the hands slowly scanning down the body. Feel your body totally relaxed. Bring the attention fully back on the body. In again, deep inhalation, collecting the qi up. As you breathe out, sinking down, guiding the qi all the way down. Good. And in terms of, because we say depression very often is caused by the insufficient amount of qi in the body. So one of the things we could do is to ask patients, feet shoulder width apart, have the hands roughly about 45 degrees out, keeping the arms straight, straight arms, and tilt your middle fingers up towards the forearm. So you have the fingers coming up. Okay, now in here, as you breathe in, squeeze your shoulder blades in. As you breathe out, push the hands out. So if hopefully you can see the back. So squeeze in, shoulder blades coming in, breathe out, push out, in, out. So in your own rate, let's do 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, continue. Do it in your own rate and keeping the arms straight. Yeah, very soon you'll feel that you warm up. And every time you push the hands out, do you feel something shooting up your fingertips? And that's the chief feel we want. And we can do 10 more. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And release. Okay, slowly coming back. So this normally will ask people to do 50, 100 times, etc. Your body soon warm up. And we say 动能生阳 movement can cause help the yang energy to rise, and then that gives the body the energy to move about. So this is a very, very quick and efficient way of doing it. And I don't know if everybody believes in qi, the existing of qi. Maybe we can do a little simple exercise. Do you think we can make one hand grow longer than the other?
No.
Yeah. Okay, so on the base of our palms, there is a line. Okay, so if you match those two lines together and bring the palms together, do you think your hands, the fingers, are the same length, left and right? Are they the same length?
Maybe.
Yeah. Okay, so which hand do you want to grow?
Right hand.
Grow the right hand. Okay, so you can leave your left hand here. Look, drop your right hand. Okay, yeah, drop your right hand. Okay, in here, softly close your eyes. Take a deep breath in. As you breathe out, send your breath, send the energy down your right shoulder. Feel the qi traveling down your right shoulder to the elbow, to the forearm, to the wrist, to the palms, and to the fingers. Your right hand is growing longer and longer, so long it touches the floor. Now, continue. Take a second breath in. Breathe in first. As you breathe out, send your breath, send the qi down your right shoulder. Feel the qi traveling down the shoulder to the elbow, to the forearm, to the wrist, to the fingers, to the palms. The hand is getting longer, so long it reaches the floor. Let's take the final breath. Deep breath in. As you breathe out, send the energy down your right shoulder. Feel the energy traveling down your right shoulder to the elbow, to the forearm, to the palms and the fingers. It's so long, the fingers reaches the floor. Okay, softly open your eyes, bring the hands together, try to bring that line, match that line again and bring the hands together. See whether yours have changed.
Wow.
Mine has changed. Yours, yeah, yours has changed. Yes, yours. Have yours changed as well? Vivek, yes, yeah. Okay, so you say the qi is magical. I didn't do anything to you. You did it yourself. So in a way, this it just tells you when the Chinese, when we practice Qigong, and particularly for depression or anxiety, you have to have the faith. You have to tell yourself you can do it. By practicing this as an exercise, it's to have the faith in your movement. Because in Qigong, particularly in the medical Qigong side we are doing, is we are saying there are three parts. Qi, there are three parts. One is the energy, obviously. And secondly is the information that you are giving to it, and then plus your exercise, etc. So that is the information you are giving to the qi. And I believe any of the meditation, whether we do the qigong, like one of the things we do is If you stand with your feet shoulder width apart, have the hands in front of your lower abdomen. As you breathe in, bring the palms out. As you breathe out, squeeze the chi together and breathe in. Slowly, slowly come up. Breathe out, sinking down. So as you are doing this, the more you do it, the more sensitive you become to this chi in between your palms. You can get it bigger and it's still there. And then it feels like when you bring the hands together, there's the resistance. When you pull it apart, there's something that pulling, sticking your hands together, etc. Practice this. After a while, you're more sensitive. And then when you have depression or anything like that, you just have to be standing there. And all you need to do is to have soft knees. So soft knees, bend it slightly, have the hands, the whole body is relaxed. Don't shrug the shoulders. Okay, and then relax and just keep pulling it. But you give yourself the information. You are drawing in the fresh, energizing chi. You are when bring hands in, you bring in the fresh, energizing chi. When you open out, you release any anxiety, any anxious thought, any unhappiness. You just letting go. Okay. We can do another one that's I often use for my students. It also helps with the practicing the balance as well. It's taken from the 5 animal play about the birds flying. So stretch your fingers out. So much so, open your hands as big as you can. Even all the webs gets the stretch. We don't normally exercise the web part. Bring middle finger and ring finger together. Each finger relates to an organ anyway, by the way, and bring your thumbs closer. So when you look at your palms, so as if you can hold some water on the palms, so these are your wings. Okay, we are going to practice flying like a bird. Just the hand movement itself, you see it's opening the chest. It's helping you to use the full set of your lungs for your breathing. And then we stand on one leg and then pass it the message I'll give you. So follow my instruction. So when you're ready, soften the knees, sink your weight into your right leg. Cross the hands in front of your lower abdomen. Breathe in, lift your left knee up, hands coming out. Okay, breathe out, soften your supporting leg, sinking down. So this helps with your balance. Your muscle will have to work super hard to keep you in position. And then these birds flying high, have the hands not touching but quite close, and slowly flapping the wings down. We'll change our legs. Breathe in. As you breathe in, your hands join in the fresh, energizing chi from the universe. And then, so coming up, join in the fresh chi. The center of your palm is the biggest opening of energy channels. As you flap your wings down, think that you are releasing anything you don't want in the body. It comes out through the center of your palms. In again, join in the fresh, energizing chi, sinking down. So all your movements are synchronized with your breathing. Okay, any positive chi, any healing power, any warmth, friendship, love. So we draw into our body. So in again, any anxiety, any negative thoughts, any illness, as we flap our wings out, they come out from our body through the center of our palms. And then in again, imagine you are this elegant bird flying freely in the sky, free from all restrictions, physical or mental restrictions. You are totally free. And again, so you feel energized with each time you flap your wings up, and you feel your body cleanse every time your wings flapping down. Okay. So this, in a way, is one of the exercise that we do. It helps with our balance as well. And then by stretching, we'll open the energy channel, the liver and the gallbladder meridian channel at the side. Yeah. And then with hands like this, you are working a lot on the wrist. And along the wrist, there are acupoints to do with sleeping and the mind and etc. So by engaging them, you help the energy flow. This is also a shape that is like a V shape. You get the energy into the 百会 acupoint. Okay. And then 劳宫的 sometimes people would ask, well, where is the center of your palm, your 劳宫穴? Is you make a fist, make a tight fist, and then release all the fingers except the middle finger. Where the middle finger touches is your 劳宫 acupoint. That's the center, the biggest energy opening in the body. So by flapping it like that, and also if you give the order to your mind to do the things, and it will happen, just like we grow our hands before. But anyway, so this is just one exercise there to show that there is a lot that Qigong can do, simple things that Qigong can do. I think sometimes we need to establish that belief in ourselves, the belief in the practice that we are doing, and then it will be more effective. I think many things happens in the mind, and we need the physical exercise there to enhance that. Yeah. And then there are also sort of a lot of grounding exercise. So the grounding exercise one would be like if people are thinking about those anxious thoughts and they want to calm down their mind. One of the things we do, I mean, I'm wearing shoes, but imagine this is your foot. So the ball of the foot, and then these are your toes. So we can, when in our breathing, we bring the mind down to the feet. With Qigong, we say where the mind goes, the energy flows. So 意到气到, the mind goes there, the qi goes there. So normally we say, well, for meditation, you think about the third eye. But if you have high blood pressure, you don't want to think about the third eye because it causes the qi to rise. And then we'll say, if you have high blood pressure, think about your feet. You want to bring it down. Most of the time in Chinese, we say meditation, we think about the lower dantian, so 1.5 or 2 fingers beneath your tummy button, and you think about that part. But if for a woman during menstruation, it could cause them a very, very heavy period because, again, the mind goes, where the mind goes, the energy flows. Energy flows, it leads the blood. So energy goes first, the blood follows. And that is a bad thing. So you may then, in that case, will ask the practitioner to bring the focus point higher up. But anyway, so this movement about the feet is, there is an equivalent acupoint. Just now we found the center of our palm. There is an equivalent point in our soul. In our soul, that point is called 涌泉, the spring bubbly point in our soul. Okay, and then if you think about that point, and that it helps the energy to come down a bit. Also, when we say doing the exercise, just thinking about it itself is not enough. It's better to have some movements. So you bring your toes up, and then you flatten it, and then you use the toes to grip the floor, and then you flatten it. You do this several times, and then you will be able to one is to help the qi flow to the feet. And then it also helps you if you have high blood pressure and you think that the mind is going too much and you need to calm it down. Okay. There is another very simple thing we can do, we can practice now, and I'll talk about it later. We call it red dragon stirring the sea. So the red dragon is your tongue. Okay. And we use the tip of our tongue to massage every single one of our tooth 3 times one direction, 3 times the other direction. This is the tongue inside. And then you put the tongue in between, outside the teeth. So between the teeth and the lips. Okay, 3 times each direction. then you generate a lot of saliva, and you use the saliva to rinse the mouth and then swallow it. Okay, let's do it the proper way. Let's do it 6 times on each. So altogether 24 times, 6 times in each direction. Inside first. Opposite. Outside. Opposite. Have you generated a lot of saliva? Rinse. 9 times and then swallow in 3 parts. And in your mind, you think the elixir of life that you've just generated coming down to the lower dantian. But anyway, this is so effective as a cool down exercise that we routinely recommend it to people that's going through chemotherapy. They have dry mouth symptoms, and it's really difficult. I mean, dentist was telling us it's really difficult to get people. They give them, prescribe them mouthwash, asking them to drink plenty, etc., etc. Yes, continue to do those. But the one additional thing they can practice is this Qigong practice, using your tongue just to circulate and stirring, red dragon stirring the sea, and sometimes like clenching the back teeth as well. All these helps the production of saliva. You as medical professions, you know the useful enzymes in the saliva and what you can help the body, etc., etc. Very simple ways, and doesn't cost anybody anything. I think probably Big Pharma would not want us to promote it. But I think I really like what Professor Gupta mentioned before, is to empowering the individuals to do things and for themselves, make them feel they are in control. And a lot of and I mean, even if simple Qigong routines, lift Qi up, pour Qi down, etc., or the little Cheng Qi we've doing before, and the red dragon stirring the sea, anybody can do it at home. Even if you want to practice, there's some a bit more complicated routines. It's far cheaper to train instructor than to train medics, and the use of time. A medic can see the doctor one by one, but with instructors, we can teach a whole class. Obviously, we can do with medical Qigong, we can do one-to-one treatment and guidance. That's we are talking about slightly different things, but it's still far more effective for doing this. So I think really I am interested in doing more work, and maybe with NHS, if you have a context, doing sort of larger scale of trials, clinical trials, and see how we could improve that.
That's wonderful.
So anyway, I think I've talked too much. I should leave it for discussions.
I think that was wonderful. It was such useful, not only just understanding of the whole Qigong and what happens, how it happens, but more importantly, practical exercises. And I feel that there is, for some reason, a little bit more generation of energy. It's not that it can happen in yoga, meditation, and prana, and very similar, but it's a different method, and it's a movement method with eyes that you can see that. I think, again, mind has miraculous power to do it, and it can generate the energy, and it can increase the energy. It was interesting to see. I was just trying to find my finger back to normal. Otherwise, I was
It will
thinking,
go back. Don't worry.
I was
You
thinking
won't go
what I
wonky.
need to do to bring it back. Otherwise,
In time, it will come back.
yeah, it's okay. It's back now, normal. I think it's okay. Yeah.
Yeah,
So
yeah.
it's important to really think that mind has miraculous power, and mind and body connection. I was just presenting a paper last week into IIT conference of mind body a conference, and that again is neuro-linguistic programming. Some of what you talked is also taught in the neuro-linguistic programming and how you can program the brain to do that. And I use it on regular basis in my obesity weight management clinic, because it's all everybody knows if you eat less and do more exercise, you will lose weight. The real life is the obesity is going up. So we need to do something else which is different, cost effective, simple, no side effects, and bring the results. So you have demonstrated that simple, easy things can be used, as you mentioned, about bringing the chi up to increase the energy flow, and very useful in chronic fatigue syndrome, fibromyalgia, weakness, day-to-day problems, where you're not feeling up to speed. You can just do little exercise to bring it up. And it was really good. I've not heard of that. In hypertension, you can bring the chi down, to bring the blood pressure down, instead of taking the antihypertensive medications for years and years. So very good.
So maybe we can find a project to work with people with high blood pressure and see. And then I think high blood pressure is one of those things that we can actually measure it.
Yeah.
So we can demonstrate a result before the exercise, after the exercise, at the beginning of 3 months trial, at the end of 3 months trial, etc., etc. I think it's a topic that we could go into after the session, and we'll plan something.
Amazing. So it was really, really very useful. Thank you so much, Visha, for a brilliant kind of demonstration of what can be done with simple things. And I think we can use it on a day-to-day basis to improve wherever we are. To quality of life is what depend on us instead of external factors.
Good.
So
Yeah.
amazing.
And should we ask, is it, I don't know how to say your name,
Vivek?
Vivek?
Vivek, yes. Hi.
Vivek, yeah. What do you feel? Do you have any questions? Did your finger grow?
Yeah, it does because the energy goes into that area with the flow and the stretch you will do. It has to grow. It's the impact of the mind breath which goes into action and enhances it. And that's why it's all known fact that these traditional sciences from wherever, whichever part of the world, I attribute it. The origin is yoga, as you have very clearly covered, which was taken by the Buddhist monk there, and that's how it originated. We know that it came from Kerala, what you were mentioning. I've seen that art, I have witnessed it, I have done studies about it. So yeah, it is. And the question I have was, when was the Qigong? I mean, when was the which year was it it came into existence? How many years old this science is?
I think Dao Yin, like the earliest written evidence I've shown you, is just short of 2,000 years.
Yeah. So yoga, the written evidence is 7,000 years, and before that, it was traditionally handed over by word of mouth. Because but Patanjali came around 8,000 years, 7,000 years back, and he scripted it in the kind of written format. And I'm not surprised that this is 2,000 years back, which came into origin after when the Buddhist monk took it, and obviously it was kind of with the local tradition blended and accordingly kind of refined in that manner further, which makes it a interesting variation of that. It's like, one single rose, but when it goes to a different environment, it blooms slightly in a different way because of the environmental ecosystem and all, and the color changes and all the things because of the geography changes. But originally, it's a rose. So the origin comes from yoga, with which I disagree with my colleague who was mentioning that in yoga we don't do that, because we do the ujjayi breath is the breath which we mention very clearly in a yoga asanas to be doing when performing the asanas. And yoga is a flow of movement, and it can be a cardio when you do like sun salutations faster, but when you do it very slowly, then it becomes a different level of exercise in the ujjayi breath, and then it makes the whole difference. And that's how the advanced versions of it, which has originated from that, is what you demonstrated so beautifully. And I really enjoyed it. And thank you for that. And the one thing which I would like to just last mention is is it necessary? I mean, it's a question or a comment, whatever way you like to take it, that when you were mentioning in second exercise, that think of the all the worries, the negativity, the anxiety, what is unpleasant going away. Why we have to think of that? Because if we will think of that, then that will come more because you're
Yeah,
thinking
yeah,
about
yeah,
it.
yeah, yeah,
Why
yeah. I
not?
see. I see what
Why
you
not?
mean. Yeah.
Why not we do that? Think of all the good things you have, because
Yeah, yeah,
what
yeah,
is darkness? Darkness is absence of light. If you're thinking of
yes.
darkness, so in my
Yeah, yeah.
room right now, I can see a sunny area and I can see the
Mm,
dark area. It depends where I want to focus on. If I want to focus on the dark side, then
yeah.
I'm making myself down. So if I'm going to think of anxiety, think of worries, why
I
not
know,
think
I
of the
know, I know.
positive things only, and
Yes,
with the
yes,
energy and
yes.
flow and the prana
Yeah,
focus on that,
yeah,
that will enhance.
Yeah.
Because that's what yoga
I
teaches me.
yeah,
But I was
yeah.
wondering,
I
why are
totally,
you
I
going in that
totally
side?
agree with you. Yes,
Thank
yes.
you.
Yeah, it's the attraction rule. Don't even think about, don't even mention it. Just use positive words, use positive things. Yeah, yeah, yeah. I think thank you. I'm going to use that suggestion and modify my instruction in teaching, and don't mention about bad things. It just all good. Just think about the positive things. Think about light, think about love, think about yeah.
Or
Thank
even
you
don't
so much. Yeah.
even don't think about it. Think the flow of the energy which is flowing so smoothly. Just feel the experience. That itself is
Yeah.
positive, you know. Because
Mm-hmm.
I was experiencing it, because being a yoga teacher myself, I
Yeah, 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 yeah.
I can experience it, and I was getting the same sensations, and I was getting the
Yeah.
prana high, which happens in my forehead very clearly,
Mm-hmm.
and I
Mm-hmm.
experienced exactly the same what I get through yoga. It was exactly the
Mm-hmm.
similar experience,
Yeah.
and very wonderful as
Yes.
well. Thank you.
Yeah, great. Thank you. And about the link between Qigong and yoga, I think I should take the more practical view of it's silly to debate who is the origin, who is the thing, because then historians will say, well, this culture has got written evidence, that culture has got sort of an oral tradition, whatever. We don't need to worry about that. But what we see is through the Silk Road, there is a lot of exchanges of ideas. Then they influence each other. And I think the fusion is what we should aim for. The whole point of biointegrated medicine is to get the best of everything. Pick what is useful to you and then make the best of it. I think
Yeah, I
that
fully
Absolutely.
agree
In
we
with
fact,
you.
should.
you mentioned that.
Normally I don't speak about it. The only reason I spoke about it, because I needed to correct, because being a yoga teacher, as I say, I have 500 hours of training and I know the whole history.